What else
right
do you want to
now.
talk about?
I don't know. Reconciliation.
Well,
Okay, what do you want to say on that?
how are you
Well,
feeling?
well, look, it's early days. Right now, I think a fair-minded person could see that the bill in the Senate is pretty much held together with spit. That will change. How quickly it'll change, I don't know. Some of my colleagues have the ability to go from angel to a-hole in about 3 seconds. And it's okay to have a meltdown. You just can't unpack and live there. And we're in the part of the process. I've been through several of these reconciliations. Probably the toughest one was on health care, which this one is, health care is part of it. I've been through several of these, and you go through phases. And we're in the angel to a-hole phase. But we'll get it worked out. I still think, obviously I could be wrong. I can't predict the future. I still think that a bill will pass the United States Senate, no Democratic votes, and I predict we'll get all but 2 Republican votes. But we've got a lot of work to do.
Can you
Think
do that
you
by
ever need
July
a vote?
4th?
I'm
Can you
sorry?
do that by July 4th?
It's going to be a challenge. It's clearly going to be a challenge because we're going to be. You have to keep in mind that we got the Genius Act done, but we also have to stop and deal with the rescission package, which is very, very important. And there's a time limit on the rescission package.
And do you think you're going to take up the rescissions
Well,
package?
I'll get you.
Do you think you're going to take up the rescissions package before reconciliation? And what are your prediction chances of whether you'll
Well,
vote next week?
we're going to have a hearing on appropriations. Coon has sent the bill to Collins, and we're going to have a hearing in appropriations, which I hope Russ Vogt will come over and answer all questions. Then it will be up to appropriations to make a decision. If approps doesn't do something by July 17th, then any senator can make a motion to discharge it. We need to have a vote on this rescissions package. You're either serious about reducing spending or you are not, and this is a chance to test who's truly serious about reducing the deficit and who just wants to talk about it. Let me get this lady was next.
In terms of Medicaid cuts and the impacts on rural and safety net hospitals, what do you think? Do you agree with the current version of the bill and what it does, or what would you like to see?
Well, I think most of us are still going through the bill. I'm still hearing from the healthcare people. What I'm asking folks to do is share with me data and facts, not just hyperbole. Because that's what we're down to now. I mean, nobody is for. I'm very proud of the fact that in America, if you're too poor to be sick, we'll pay for your doctor. We won't let you die. So nobody wants to do anything to hurt Medicaid. What we want to do is lift Medicaid up. But that also means making sure that Medicaid is there for the long term. There are going to have to be some changes made to Medicaid. I mean, that's just all there is to it. The states have been acting like these carnival barkers that are trying to entice you to go play their ring tosses at the fair that are always rigged. I mean, they're pretty smart, and they've used the provider taxes and other mechanisms to basically circumvent the rulers. I don't want to say cheat because what they're doing is illegal, but it's also unaffordable. And that's what we're trying to address. Last one.
Are you on board with the Department of Defense proposed defense budget, or is that too small?
I think we've got it's too small. We've got a lot of work to do. I think the way the president is looking at this, or at least his budget vote.
Welcome back to our coverage of key domestic policy issues in the United States. Today, we're focusing on critical debates taking place in Congress, including reconciliation efforts, healthcare, Medicaid, defense budgets, and the broader challenge of fiscal responsibility. These issues not only impact millions of Americans today, but will also shape the long-term trajectory of the nation's social and economic landscape. In the interview Senator named discussed the ongoing reconciliation process in the Senate, describing it as a delicate and complex negotiation. The reconciliation process, particularly for legislation like healthcare and the broader fiscal package, requires balancing competing priorities while navigating the procedural and political challenges inherent in Senate operations. According to the senator, the reconciliation bill is currently held together with spit, a metaphor that captures the tenuous nature of the agreements being forged. Despite this, there is cautious optimism that meaningful progress can be achieved, with potential for significant legislation to pass even without Democratic support, relying on strong Republican backing. Healthcare and Medicaid were central topics in the discussion, reflecting the ongoing challenge of ensuring access to care while maintaining fiscal sustainability. Senator Name emphasized that Medicaid must be preserved for those who rely on it, particularly vulnerable populations in rural areas and safety net hospitals. At the same time, the senator pointed out that states have sometimes exploited loopholes, such as provider taxes, to circumvent budgetary constraints. The goal of proposed reforms is to address these structural issues and ensure the long-term viability of Medicaid, while also maintaining its core mission, providing essential healthcare services to those who cannot afford them. Defense and national security spending were also addressed, highlighting the need to strengthen the Department of Defense while managing budget constraints. Senator Name suggested that current proposals may be insufficient and that additional funding will be required, both through reconciliation and broader appropriations bills.
They're looking to top up defense through reconciliation, and we're going to top up defense through reconciliation. But we're also going to need to put together some kind of defense bill, which helps the department permanently. That's going to be a challenge. Last year, I'm on the Appropriations Committee. Last year, we passed, I think, 12 bills out of the Appropriations Committee. And a lot of them I didn't want to vote for. I had to swallow. Really had to swallow. We'd been assured that Senator Schumer would bring them to the floor and we'd have a chance to amend them. And, of course, Chuck didn't do that. And that left a very, very sour taste in people's mouths. So there's a lot of skepticism now when our leadership tells us, well, we're going back to regular order in appropriations. I hope so, but, pigs may fly someday too, but I doubt it. So we'll have to see. We're dealing with political reality. Okay, gotta go.
This reflects a larger tension in U.S. governance, the need to balance immediate fiscal realities with long-term strategic priorities, ensuring that the military is adequately resourced while addressing domestic policy needs. The senator also addressed broader legislative challenges, including skepticism about whether leadership will follow through on promises to restore regular order in appropriations and legislative procedures. Past experiences, particularly with healthcare and other major bills, have left some lawmakers wary assurances from leadership, emphasizing the need for vigilance, accountability, and strategic planning throughout the legislative process. Despite these challenges, the senator expressed cautious optimism that progress can be made, stressing the importance of data-driven policy decisions and evidence-based debate over hyperbole or political theater. Overall, the discussion underscored the interconnected nature of domestic policy, fiscal responsibility, and political negotiation. Legislative success requires balancing competing priorities, maintaining transparency, and ensuring that reforms are sustainable over the long term. Whether addressing healthcare, Medicaid, defense spending, or reconciliation, the key is thoughtful, deliberate policymaking that serves both immediate needs and future generations. For ongoing coverage of U.S. politics, healthcare policy, and congressional negotiations, be sure to subscribe, like, and click the bell icon to receive updates. We'd love to hear your opinions in the comments. How do you think Congress should prioritize healthcare, fiscal responsibility, and defense spending while navigating a deeply divided political environment? Stay tuned as we continue to bring you the latest insights and analysis on these critical issues shaping America's future.